Okay, so welcome to Chapter 18, where we'll be covering geriatric emergencies. So geriatrics are impact of age-related changes on assessment and care, recognizing and reporting abuse and neglect of geriatric patients or our elderly patients, and recognizing and managing the life threats associated with this age grouping of patients. A geriatric patient is commonly defined in the U.S. as a patient who is older than 65 years of age. The geriatric population in the United States is the fastest growing segment of society. According to the U.S. Census Bureau, 16% of the U.S. population, or 52 million people, were the age of 65 in the year 2018, and it is expected to double by the year of 2060. Natural aging process results in a decline of functioning of all body systems. Heredity and lifestyle choices influences the speed at which this decline occurs. Do not judge or prejudge physical or mental condition of older patients. Many older patients are vibrant and healthy and can run circles around us academically. Because older patients experience problems more frequently than younger people, most EMS systems respond to many calls involving geriatric patients. These calls will be less stressful for the patient and for you if you understand how to effectively communicate with older patients. It is essential that you conduct a complete secondary assessment on all patients and be especially careful as you examine your geriatric patients. Try to keep their spouse, if they're present, informed and up to speed with what's going on and what you're finding to help alleviate some of their stress as well. Two of the most socializing senses are hearing and sight. Many people experience some loss of hearing as they age, and their ability to see often diminishes as well. Activities such as driving and walking can become more dangerous. Impaired vision and confusion often contribute to mistakes taking medications. Other conditions such as cataracts or muscular degeneration may develop as well. Some older adults require the use of a hearing aid. Hearing loss is an invisible disability, and often hearing losses are more pronounced in higher frequencies. A person may be able to hear a low-pitched voice, but not hear the higher-pitched voices. So sometimes it may be beneficial to lower your voice to a deeper tone, and they may be able to pick up on that a little bit easier. Some older adults require the use of hearing aids, and people with certain inner ear disorders are more prone to poor balance and more frequent falls than the general population. Communicating with hearing impaired patients, be certain an older patient can actually hear you and understand what you're saying. Identify yourself and speak slowly and clearly. There is no need to shout. Oftentimes, if somebody can't hear you, but they can see that you're shouting, and it might agitate them or raise their suspicions as to why you're shouting. Speak directly into their ear and maintain eye contact if the patient can read your lips. If you are still having difficulty communicating, offer a paper and pencil or using common objects in the house, such as a coffee cup or a doorway or a light, things like that to kind of help you decipher your communication. And if you know it, use sign language, and also if the patient knows it. Here's simple phrases in sign language. Here on the left you have the signing for sick. Hurt is pointing your index fingers towards each other, and help here on the right side. Look for signs indicating visual impairment during scene size up. Eyeglasses, canes, service dogs. If you think the patient is blind, ask them if they can see you. A visually impaired patient may feel vulnerable during an emergency scene. Tell the patient what is happening, identify noises for them, and describe the situation and the surroundings. Find out the patient's name and use it. Provide emotional support. Keep eyeglasses with the patient if possible. The patient may be severely handicapped and anxious without his or her glasses. So here's some techniques for communicating with older patients. Identify yourself and look directly at the patient. Speak slowly and distinctly. Explain what you are doing or going to do in a clear, simple language. Listen to the patient. Show the patient respect. Do not talk about the patient in front of the patient. And be patient. As a person ages, several changes occur to the musculoskeletal system. Muscles lose strength. Part of loss is a result of decreased physical activity, and part is due to the aging process itself. Discs between the vertebrae become narrow, which can cause loss of height, curvature of the spine, loss of flexibility. Bones in the skeletal system lose their strength because of the loss of calcium. Loss is especially pronounced in postmenopausal women and can result in development of osteoporosis. Osteoporosis is a disease in the density of the bone. Many older people experience some loss of balance caused by a variety of issues. Incidence of falls among older patients, or which loss of muscular strength, weakened bones, and decreased balance result in an increase of falls. Falls in older patients result in an increased risk of brain injuries because blood vessels in older patients are more fragile and the brain gets smaller as the person ages. And the vast majority of the elderly population is on some sort of anticoagulant or antiplatelet medication, also known as blood thinners. Slowed movement. So as the patient ages, movements become slower. Lend a helping hand or a supporting arm. Allow enough time for the patient to move safely rather than trying to rush them. Fractures occur frequently in the geriatric population because of the loss of bone density, often results in osteoporosis. Fractures of the wrist, spine, and hip are particularly common. The geriatric patients may have a reduced awareness of pain as well. They may not realize the seriousness of their injury. Splinting and spinal immobilization of a geriatric patient can be a challenge when a spinal curvature or osteoporosis is present. Because of this decreased awareness of pain, it needs to increase our index of suspicion for injury. They occur most frequently in older women. Patients may experience a minor stroke, heart attack, or confusion before a fall, and they may not have seen an obstacle, or they may not have seen an obstacle. Injured legs, usually but not always shortened in relation to the other leg. This is more common in femur fractures, and this population of patient, your large bone, your femurs, your hips, and pelvis fractures are more common. Even I've seen them even bumping up against the corner of a kitchen counter, not even having fallen, and they still receive a fracture from that. The toes of the injured leg are externally rotated in these leg rotations. Every older patient who complains of pain after a fall must be examined in a hospital. Splint the patient and arrange for prompt transport. When splinting these patients, we want to do so for comfort as well as immobilization. Because of the advanced age, they are more susceptible to ulcers, bed sores, bruising, things like that. If in these situations you decide or you move to use a long spine board, extra padding, if you can avoid using a long spine board, that's in some instances maybe better, or if you can wait and not move the patient until higher level of care, like a paramedic unit or a transport unit can arrive on scene, maybe it's better to wait for that so that they can clear that spinal injury. Conditions that may occur with age include hearing loss or impairment, sight loss or impairment, loss of sensation, slowed movements, fractures, senility, loss of bowel and bladder control. As people get older, they are generally less able to fight off diseases. Their immune system becomes less effective and depleted. They are not able to cough as effectively, which can lead to pneumonia or other respiratory ailments. They have increased difficulty handling their secretions. Cardiovascular diseases are conditions that affect the heart and blood vessels. As a person ages, the body loses its ability to speed up the rate of contractions of the heart. At the same time, blood vessels become stiffer and narrower by fatty deposits, or narrowed by fatty deposits within them. These changes can increase occurrence of cardiac disease, such as heart attacks, angina, and congestive heart failure. Strokes and AAAs, or abdominal aortic aneurysms, are two common conditions related to problems with blood vessels. Geriatric patients may not have the classic signs and symptoms of medical conditions. Often older patients have a decreased awareness or sensation to pain of a medical or trauma condition. Older patients are more likely to have a silent heart attack where they do not experience the acute pain of your classic heart attack. Some patients who are experiencing a stroke will not be aware of the signs and symptoms that are present. So treat older patients with a high degree of suspicion. As a person ages, the alveoli lose some of their elasticity. This condition makes it harder to inhale oxygen and to exhale carbon dioxide. Muscles associated with respiration becoming weaker with aging. So two types of respiratory diseases, chronic respiratory diseases and acute respiratory diseases. Patients with chronic obstructive pulmonary disease, better known as COPD, may live with this condition for many years. A cold or other respiratory infection can result in a medical emergency. Acute respiratory diseases can strike a patient quickly. Pneumonia is a common infectious disease in older patients. Minor symptoms can become a major illness in a short period of time. A physician should examine any older patient who has congestion and a possible fever. Some of our treatment for elderly patients with possible respiratory condition: carefully examine them, secure any accurate medical history, past and present, treat their presenting symptoms, and arrange for transport. Always maintain their ABCs, recheck their vital signs, and get that sample history. So cancer can strike any part of the body. Patients call for help when complications from cancer result in acute pain, shortness of breath, shock, or some other type of medical condition. Provide support and transport to a medical facility for stabilization. Altered mental status, some common causes of decreased responsiveness in older patients. There are three common causes: lack of adequate oxygen to the brain, low blood sugar, hypothermia. Carefully assess your patients with decreased responsiveness and provide treatment according to the signs and symptoms that you note. And remember to treat your patient before you treat their vitals. Remember, your vitals are supporting factors in your assessment. Medications. Many older people take a large number of medications every day. They may see several doctors for different conditions, with each doctor prescribing different medications. Some medications may interfere with the action of other medications or cause adverse side effects. Older patients may not take their medications as instructed either. Determine which types of medications the patient takes. If the patient is being transported, bring medications to the hospital with the patient. Infectious diseases are illnesses that are caused by bacteria, viruses, or fungi. They may affect different body systems or different organs of the body. Older people have weakened immune systems. Signs and symptoms of an infectious disease vary depending on the organism causing the infection to the body system primarily infected. Common signs and symptoms include fever, fatigue, coughing, muscle aches, and diarrhea. Sepsis is a severe and potentially life-threatening complication of infection. It occurs when chemicals are released into the bloodstream as a result of the infection and trigger an inflammatory response throughout the body. It is most common in older patients and people who have weakened immune systems. And if left untreated, sepsis can progress to septic shock, a condition in which your blood pressure drops dramatically. Septic shock can often results in death. The emergency medical responder's role is to understand that older patients are more likely to contract infections and develop sepsis, and recognize that older people often do not realize how sick they actually are. If an older patient shows signs and symptoms of an infection, such as fever, diarrhea, fatigue, muscle aches, or coughing, and also a lot of times a source of infection, he or she should be evaluated by a physician to rule out a possibility of an infection of sepsis. Urinary tract infections are a very common source of or cause of infections that can progress to sepsis. Many patients with chronic conditions are now treated at home by nurses or family, and their lifespan has increased. A variety of complex medical devices are used with patients who require long-term care. Devices that help patients breathe include ventilators, oxygen enrichment devices, or oxygen saturators, surgically inserted breathing tubes, and monitors. Patients with certain heart conditions may have pacemakers and automatic defibrillators inserted under their skin. These are more commonly over the left clavicle, sometimes over the right clavicle, and some of the more newer devices you actually can't see them underneath their skin. But typically they'll look like a little raised portion about the size of half a lime, thereabouts. Tubes inserted into a patient's arm, neck, or stomach may provide fluids or food. Catheters may drain urine from the patient's bladder, and patients who require long-term care often take a wide variety of medications as well. Remember, your role as an emergency medical responder is to assess the immediate problem, take appropriate steps in caring for the patient. Do not become overwhelmed or distracted by complex equipment. Remember your ABCs. Question the patient or the patient's caregiver about the problem. Get as accurate of a history as you can. In most situations, you need to help stabilize the patient only for a few minutes until more highly trained EMS personnel arrive on scene to provide care and transport. Here's a picture of a much older ventilator here on the left side, and an abdominal tube. Okay, so moving on to depression. It's the most common psychiatric condition experienced by older adults. Depression, it is estimated 1 to 5% of 65 or older years old or older adults. The rate of depression in older adults rise significantly with the loss of independence. 13.5% for those who require home health care, and 11.5% for hospital patients. Depression is more common in women than men, and contributing factors can include living in a nursing home or assisted living facility, living alone, or loss of a spouse or a close friend. Declining health and chronic health conditions or terminal illnesses. Be alert for signs and symptoms of persistent feelings of sadness or despair. If you observe signs and symptoms of depression, bring them to the attention of the other EMS providers or medical professionals. Older men have the highest suicide rate of any age group in the United States. Older people choose more lethal means than younger people do. This tendency results in more deaths from suicide in this age group than in other age groups. Many factors that contribute to this problem: physical illnesses, especially terminal ones, loss of a loved one, alcohol abuse. Listen carefully to your patient and be alert for indications of hopelessness, depression, or attempts at suicide. If you suspect a patient may be considering suicide, arrange for transport. Be alert for your safety as well, because weapons may be involved. As people age, some experience a decline in mental function. A pattern of decline in mental function is called dementia. It is a progressive and usually irreversible decline in mental functions. It is marked by the impairment in memory and may result in decreased reasoning, judgment, comprehension, and ability to communicate verbally. An estimated 20 to 40% of people older than the age of 85 years have some degree of dementia. Senile dementia is a general term used to describe an abnormal decline in mental functioning seen in older adults. Dementia can be caused by many different conditions: small strokes, hardening of arteries, and hereditary. We have also Alzheimer's. Is a chronic degenerative disorder that attacks the brain and results in impaired memory, behavior, and thinking. Patients may experience mood swings and feelings that people are plotting against them. Patients may wander at night and are at an increased risk for falls. In terminal stages, patients may be unable to walk, lose control of their bowels and their bladder, and often become unable to swallow. When caring for patients with dementia, speak clearly and use the patient's name. Let the patient know what you are doing at each step of your assessment and treatment. You may need to rely on family members or caregivers to provide accurate medical history, and use a kind and caring approach to make patients more comfortable. A hospice is a healthcare program that brings together a variety of caregivers to provide physical, emotional, and spiritual, social, and economic care for patients who have terminal illnesses and who are expected to die within the next 6 months. Hospice care is provided in patients who are home or in a special hospice facility. Interdisciplinary programs can provide pain relief and other supportive care. One of the goals of hospice is to provide pain relief without use of needles or IVs, and that is provided through oral medications, special pain-relieving patches, medicine placed in the mouth between the gum or the cheek, or also known as buccal medications. EMS is usually called when the patient experiences unexpected problems, such as shortness of breath. If you are called, it is helpful to know the purpose of the hospice, or why this patient is on hospice care or under hospice care, and the types of care that it provides. Patients who are under the care of hospice may have advanced directives that request that they do not be resuscitated, so you may want to ask for their MOST form or their DNR if they have one, or any other advanced directives. Patients who have a terminal condition may have a document that outlines the care that they want to receive if they are not able to make their own medical decisions. An advanced directive may include a do not resuscitate order, which is a request to withhold CPR or other life-saving measures in the event of cardiac arrest, or in some cases if they have also stopped breathing. A MOST form, or medical orders for life-sustaining treatment. It is important for you to know the regulations concerning these documents in your state. Most forms will give you instructions of what types of interventions or treatments they want withheld. If you cannot determine whether an advance directive is valid, begin appropriate medical care and leave questions about living wills to the physicians. Never withhold care in the field if we're uncertain. So elderly abuse. Older adults who are physically weak or mentally compromised are at high risk for abuse by their spouses, family member or friend, or other caregivers. It's harder to detect because those who are at higher risk of abuse are often isolated from the public's eye. Elderly abuse may consist of physical, sexual, or emotional abuse, financial abuse, or neglect. Some signs and symptoms can include bruises, especially on the buttocks or the lower back, genitals, cheeks, neck, and earlobes. Look for pressure bruises caused by a human hand. Look for multiple bruises in different states of healing. Burns may be caused by cigarettes or hot fluids. Trauma in the genital area. Suspect sexual abuse if you find that. Signs of neglect, appearance of malnutrition. If you suspect abuse, report it to the proper authorities. Many community-based programs assist in supporting geriatric patients who need physical assistance, nutritional support, and emotional help. Okay, let's summarize Chapter 18. So the natural aging process results in a decline in functioning of all body systems, including sensory and musculoskeletal changes. Fractures often occur in older people because of loss of bone density that can lead to osteoporosis. Common medical concerns for geriatric patients include cardiovascular and respiratory diseases. 3 common causes of altered mental status are lack of adequate oxygenation to the brain, low blood sugar levels, and hypothermia. Many older patients require long-term care for a chronic condition. Do not overlook signs of mental health problems in older patients. These types of mental problems seen frequently in older people are depression, suicidal thoughts, and dementia. Elder abuse may take the form of physical abuse, sexual abuse, emotional abuse, financial abuse, or neglect. All right. So let's review with a couple questions. When caring for an older patient who is hearing impaired, you should A. Speak very loudly to be sure that the patient can hear you. Or B. Speak directly into the patient's ear or maintain eye contact for lip readers. C. Assume that the patient can read lips. Or D. Do not attempt to communicate because it will only frustrate the patient. And the answer is speak directly into the patient's ear or maintain eye contact for patients who can read lips. That is B. Question number 2. Fractures occur frequently in the geriatric population due to a condition that weakens bones known as A. Syncope, B. Osteoporosis, C. Dementia, or D. Dislocation. And correct answer is B. Osteoporosis. Next question. Which of the following statements regarding suicide in older adults is most accurate? Is it A. Older women have the highest rate of suicide? B. Most older people seek counseling when they become depressed? Or C. Older patients tend to use more lethal means than younger patients? Or D. Alcohol abuse is not a contributing factor? Which of those is the most accurate? The answer is going to be C. Older patients tend to use more lethal means than younger people. Okay, that wraps up Chapter 18, covering geriatric emergencies. Remember to go back and review your chapter in your book and check out your learning objectives pages under your My Course page. And in the meantime, if you have any questions or comments, please feel free to email me or drop me a direct message in the class chat. Our next chapter coming up will be 19, covering transport operations. Thank you very much.